Great.
Hello, I'm Chris Betts from the RCPA Conference Committee, and with me I have Ted Wright from Streamline Healthcare.
Hi, Chris. How are you today?
I'm very well, thank you.
Good.
Okay, Ted, well, what would you like us to know about your company?
Yeah, great. Again, my name is Ted Wright. I'm the EVP of Sales for Streamline Healthcare Solutions. We are an electronic healthcare vendor, so we do electronic health records across the country. We have clients in Pennsylvania and at every level of care, and so the most important thing about Streamline and our applications are we wanted to have an application that's both very flexible, easy to use, and it can evolve with the organization, whether you're a outpatient service provider, residential services, CCBHC, or any type of other type of organization. We want to make sure that we provide all the solutions that you need to be successful.
Excellent, thank you. So are there any specific specialty services or products that you want to share?
Absolutely. So what we have is we call our electronic record a platform of care. And when we say that, we mean that as organizations evolve and change, like maybe you're not doing primary care today, maybe you're doing a co-located primary care with an organization, you need to share information. Maybe you're doing residential, but then you want to do something that's more substance abuse detox or inpatient, or along the CCBHC continuum, if you're working with designated coordinating agencies and want to authorize them to receive, to provide services and adjudicate claims, we see the market evolving. And so we want to make sure that we provide every sort of nuance in one web-based platform for organizations. However you change and however the market changes, we want to be there for you.
Great, thank you. So of course, a big question here, how has COVID-19 impacted your way of doing business?
You know, that's interesting. So first of all, we, all of our sales team and a lot of our implementation team is across the country. And so we're spread out regardless. But with COVID-19, you know, we stopped traveling and we stopped having those face-to-face visits. What we found is very important is really connecting via a Zoom meeting or connecting via GoToMeeting and having a face-to-face or as close as we can get face-to-face conversation. We've, with our client base and the changes in their environments, we've had to do some updates very quickly on our application for web-based meeting and telehealth. And so, and that's been done and also with billing, we've updated those in a couple of different states for their specific Medicaid requirements. But we find if we connect with our audience, if we talk to clients, if we listen to what what your requirements for moving to an EHR is, we've done well. We've also have completed implementations completely remote, and also done all our meetings remote too. So face-to-face visits are important, but we have the ability to be flexible and meet our clients where they have to right now. So
excellent, excellent, thank you. And what is your perspective on doing those implementations that you've had to completely virtually or completely remotely? How have they been different?
You know, it's in some respects they're the same as they've been. I mean, every organization, the EHR is not just a clinical system or a billing system anymore. It's the lifeblood and backbone of your organization. And so, so organizations, we review the system, review their processes. We make sure that the experts in-house in your facility are trained and know what they're talking about, right? So just like you would go through Joint Commissioner accreditation or CARF accreditation, people know their business, right? And we want to make sure that they know this in an electronic format as well. As managed care is more and more prolific, and what the term of value-based medicine or value-based care means outcomes. It means data. It means, Chris, I want to know in your residential facility who's where, who's taking their meds, who's moving along the continuum of care, and I don't want to hear from you. I want the data, and so we've been able to instill that and help our customer base along that path.
Excellent. Thank you. Thank you. So what creative and innovative ways are you helping your clients?
You know, we want to make sure that 80% of our clients are reimbursed. 80% of the reimbursement is Medicaid. And Medicaid, as you probably know, is reimbursed is probably 70% on average on the commercial dollar. And so our organizations are not working with a lot of dollars for technology to start with. And so we need to make sure that we have an application that's easy to use, intuitive, straightforward. Some organizations have as high as 30% turnover, and we want to make sure people can sit down and do their jobs with little or no interaction. We also want to make sure that there's a gamification approach where people need to get their notes done. They need to get their assessments completed. We need to get back down to zero, and so all clinicians and frontline staff can see that in the process and make sure that they're working up to speed. So we do a number of different things too. We with go lives, we have a big party with go lives, and we take a lot of pictures. It's a real big success when people you get through this process of moving to a different system.
Very nice. Thank you, Ted. Well, what else would you like to share with this opportunity?
We're looking forward to talking to anyone if they want to talk about what they're doing and how they've succeeded in COVID. We want to make sure that we understand what other people think is important, and how other people are being successful. We have a couple of clients in Pennsylvania that are doing some different things, and we would like to introduce you to them as well, and make sure that we can be a resource, right? Whether that's what we think about the evolving technology, what we think about HIPAA security, and whether that's a web-based system or an on-site system, whether we have organizations that have hired primary care physicians and taken that in-house. So there's a number of things that we've done across the country. I want to make sure that we talk to people and learn where they are, and be a real resource for the market, and I always try to help. So
excellent. Great. Well, Ted, I thank you very much for your time. It's great talking with you. Again, this is Ted Wright from Streamline Healthcare. Thank you.
Chris, thank you for your time, and have a good day.